I was awestruck as I witnessed an event that forever changed the direction of my life and the way in which I would practice medicine. That day I watched a very ill patient with multiple sclerosis rapidly display a striking clinical improvement that just was not supposed to happen. Certainly if I hadn't seen it with my own eyes, I would have said, impossible. Although this event had been surrounded by many other similar but not quite as dramatic observations, the patient's change was so striking and occurred so rapidly that it radically altered my understanding of physiology, disease, and medicine. It happened in the summer of 1993 in Colorado Springs, Colorado. Up to that time, my private medical practice kept me totally occupied. Cardiology had been my specialty field of choice since my first year in medical school, with a sense of direction and determination not shared by most of my classmates. Even as a young lad, I wanted to be a doctor. Throughout the rest of my medical training and for nearly all of the years of my private practice, I was completely happy with what I was doing. I felt I was making a very positive difference in the lives of my patients. In about 1992, a slight twinge of dissatisfaction began to gnaw at me. Somehow the practice of cardiology just seemed to fall short. Although I had no doubts that I had helped many patients achieve greater degrees of health, I still felt that something was missing. To the relatively few people in whom I confided, I expressed my disquieting sense that there was something more important that I should be doing, even though I had absolutely no idea what this new something was supposed to be. About a year later, I met Dr. Hal Huggins, a true medical pioneer who fully realized that many illnesses begin in the dental chair. Revered by many and perhaps reviled by even more, Dr. Huggins challenged many of the foundational yet flawed practices of modern dentistry. He had concrete evidence that many standard dental procedures profoundly and negatively impact the general health of the body. Dr. Huggins was truly one of the first healthcare practitioners I had met who treated the entire patient. As a dentist, he did not practice medicine, but he did address much more than the dental problems of his patients. He and his team of assistants addressed issues of nutrition, diet, supplementation, and general lifestyle. When medical problems were encountered during examination and treatment, he made sure that his patients sought the care of qualified physicians. At that time, Dr. Huggins had a large practice that specialized in the removal of dental toxins, including mercury fillings and chronically infected teeth. Although the idea of dental toxins was not a completely new idea to me, it was never much of a consideration when I evaluated and treated my cardiac patients. I never considered the possibility that previous dental treatments, especially endodontic treatments, root canals, were responsible for so much of the chest pain, blocked arteries, and heart attacks suffered by many of my patients. Shortly after I met him, Dr. Huggins invited me to come by his clinic to see what he was doing. I went with an open mind, but I wasn't even remotely prepared for what I was about to see and experience. I subsequently visited Dr. Huggins' clinic on several more occasions. Curiosity and amazement grew as I watched one patient after another respond in ways that radically challenged what my medical training had taught me to expect. A majority of his patients were extremely ill. Advanced cases of multiple sclerosis, amyotrophic lateral sclerosis, Lou Gehrig's disease, Parkinson's disease, and Alzheimer's disease were common. Many patients were already confined to wheelchairs. Certainly I had never seen or even heard of such patients showing significant clinical improvement, regardless of the protocol or intervention. Yet, in this clinic, substantial improvements were the rule. Only rarely did a patient fail to demonstrate any clear benefit other than after the typical 2 weeks of care. All patients were tracked extensively with pre- and post-treatment laboratory testing. Abnormal blood and urine tests would routinely normalize or show near normalization by the end of the 2 weeks in the clinic. Gout-like levels of uric acid would plummet, and abnormal liver and muscle enzymes would rapidly respond. The more I visited the clinic, the more the basic pillars of my medical education were shaken. Dr. Huggins consistently demonstrated a vastly greater knowledge of physiology and chemistry than any physician I had ever known, and the clinical responses of his patients consistently validated his methodology. When all of this information finally sank in, I realized that a host of chronic degenerative diseases were not, in fact, irreversible sentences of suffering and premature death. I was an eyewitness to clear and consistent ways to treat nearly all such diseases and to expect positive results. Although much of my medical understanding had already been challenged during my early visits to Dr. Huggins' clinic, it was soon to be changed to the core. On that life-changing day, a very sick, listless patient was wheeled into the dental suite by her caregiver. This woman was just one of the many wheelchair-bound advanced cases of multiple sclerosis that found their way into the clinic. She had a mouth x-ray that revealed a great deal of dental pathology, even to my relatively untrained eye. Many teeth were missing, a few dental implants and root canal treated teeth were present, and the overall bone mass in the jaw appeared to be decreased. Despite her general state of poor health, she was subjected to several hours of dental surgery that day. There were extractions, cavitation revisions, the cleaning of infected holes in the jawbone, and the replacement of a few mercury amalgam fillings with biocompatible composite materials. At the time, I quietly thought this was far too much dental work for an initial visit to the dental chair by this very ill and obviously delicate patient. After all, I knew young, healthy friends who had several wisdom teeth removed by their dentist in one visit. Most often they became effectively bedridden for several days while their strength gradually returned and good healing kicked in. But that was not the case with this patient. Almost immediately after the end of her dental surgery, she began smiling, joking a bit, proclaiming her energy was greatly improved, and even declaring she wanted to go out on the town that night with her caregiver and try to eat a steak with the few remaining good teeth she had on the left side of her mouth. I was flabbergasted, to say the least. Intuitively, I knew that getting toxins out of the body was a good thing, but this good and this quickly? I confessed my confusion and disbelief to Dr. Huggins. He smiled and just pointed to the IV bag that was still infusing into the patient. This didn't seem like much of an answer, as I had administered thousands of IVs in my life and never witnessed such an impressive patient response. He then said that it was a vitamin C infusion. Vitamin C? I was even more confused. Like everyone else on the planet, I knew that vitamin C was something good, but that it only got into the body from good food or supplements, and usually in amounts of no more than 50 to 250 milligrams at a time. However, this IV had 50 grams, 50,000 milligrams in it, and it had been infused for the entire duration of the dental work. Although I had no idea why the vitamin C was helping this patient, I immediately knew that I had found a new weapon for my arsenal of treatment options. Even then, I had no real clue as to how powerful that new weapon was, but it marked the beginning of my second and certainly most important medical education. As I look back now, I realize my earlier training was little more than a reasonably good foundation for what I would learn after meeting Dr. Huggins. Ironically, a dentist taught me more about clinical medicine and physiology than all the medical doctors in my life combined. As I continued to research the literature about vitamin C, I only became increasingly amazed. I found that vitamin C was vastly more than a vitamin required in tiny daily amounts to prevent the development of the deficiency disease scurvy.